Prevention is always better than cure. And what are these prevention that we should take to prevent cancer from attacking ourselves or attacking us? So, welcome back to my YouTube channel. If you're watching us or if you're watching this video for the first time, please consider clicking that subscription button. So, what I want to talk about today is cancer, cervical cancer. I already talked about cancer in general. So, specifically, I want to talk about cervical cancer because cervical cancer is one of the most dangerous cancer and is that it has been killing people. It is among the most top diseases or conditions that are taking lives all over the world. So, what is cervical cancer? Cervical cancer is a malignant tumor on the cervix. Malignant tumor on the cervix. And what are the causes of this malignant tumor on the cervix? What are the signs and symptoms? And how can we prevent this malignant tumor from growing on our cervix? And what are the management that in case you have a cervical cancer, how can it be managed? Let's get into the video and make sure you watch the video up to the end. And if you're not subscribed, I will continue reminding you to subscribe so that we grow together as a family. I had already said that cervical cancer is a malignant tumor in the cervix and it can grow or it can spread to any part of your body if you have a cervical cancer. So, what are these causes or what are the risk factors of this malignant tumor in the cervix? The first risk factor, the first cause is human papilloma virus. This is the virus that causes malignant tumor in the cervix. This is the virus that causes the disruption of DNA in the cervix, and therefore you will end up with a cervical cancer. So the next thing that I'm about to forget, this human papilloma virus can be passed from one person to the other. If maybe you have a partner who is having human papilloma virus, this partner can distribute this human papilloma virus to you and you can get cervical cancer. The next cause is history of the sexual history. Let me say sexual history. Do you have several partners? Do you have partners who are not circumcised? Are you that person who is sexually active? So all these factors can contribute to cervical cancer. So what have I just said? If you have several partners, I've said if you have several partners can make you to have or you can be at risk of getting cervical cancer. If you're somebody who are sexually active, especially when you are below 18 years and you have started engaging yourself in sexual activities, you can have cervical cancer. If you have partners who are not circumcised, that foreskin usually carry human papilloma virus, and then your partner can do what? Can transmit that virus to you, and then you will have cervical cancer. The second thing is smoking. Those who are smoking shisha, hey, those who are smoking cigarette, those who are smoking tobacco, you are putting yourself at risk of getting this cervical cancer. It is not that only if you are smoking you are causing damage to your lungs alone. You can also, this smoke, they usually disrupt the DNA in several organs in your body. So you get that research has said that the mucus of the cervix usually have a tobacco. And where is this tobacco come from? This tobacco or the tobacco that is found in the mucus is found from the smoke that the smoke that you usually smoke. What am I saying? This mucus, cervical mucus that contain tobacco, you will get it from the smoke that you smoke tobacco. I don't know even what I'm saying. Forget about it. You are getting whatever I'm saying. So the smoke or the tobacco that is found in the mucus of the cervix usually disrupt the DNA in the cervix, and you get that you will get cancer of the cervix. Next thing is chlamydia. Chlamydia usually put one at risk of getting cervical cancer. And so if you have chlamydia, is one of the PID diseases, and it is not treated at the right time, then you can get cancer of the cervix. Another thing is those who are using oral contraceptive, prolonged use of oral contraceptive. I've been always saying that contraceptive, if it is not natural family planning, then it is always dangerous to your body, because these things are hormones. They are disrupting the biological clock of your body, of your body. So you get that if you're using these hormones and you use them for the longest time, then you will get that you will be at risk of getting a lot of problem in future. You can get cancer, especially the cancer of the cervix. That is what I'm saying. You can get hypertension in future. You can get DM in future. You can get several conditions, maybe the condition of the veins. You can get even chest pains. I don't know where they usually come from, but because these contraceptives, they are always made of hormones, and this hormone, they usually disrupt the biological, how the normal body should function. They disrupt it, and when it disrupted, they interfere with the DNA in your body, and you get that if DNA is interfered with, you are likely to get one of the cancer. You can get any cancer, but today I'm only speaking about the cervical cancer. That is why I'm explaining it. So you can get that through when you are using this, especially hormonal oral contraceptive. You can get cervical cancer. Another thing is multiple full-term pregnancy, especially 3 pregnancy or more. You get that when you get pregnant, the immunity is always low. And when the immunity is low, your body cannot fight against any infection. And also when you are pregnant, during that pregnancy time, the pregnancy hormone or the hormone that involved in keeping that pregnancy can interfere with the the normal function of the cervix, or the normality of the cervix. So you get that if you have this pregnancy, 3 full-term pregnancy, and or more, maybe more, you are at risk of getting cervical cancer because of the hormonal change and the immunity is low. Another thing that is also a risk or is also a cause is diet which is low in fiber and vegetables. So if you are eating the other foods that are more in calories and a lot of oil, you will be a person who is obese. And when you are obese, you are at risk of getting maybe other cancers, or specifically cervical cancer. Another thing is first full-term pregnancy, especially when you get pregnant when you are below 20. When you are below 20, you are still developing. You have not fully developed to carry that pregnancy, and it will disrupt the normal function of the normality of the cervix, because when you're also pregnant, this hormone that involved in the pregnancy interferes with normality of your body. So you get that you can be at risk. I'm not saying you will get cancer. I'll say you will be at risk of getting cancer of the cervix. Another thing is family history. If you are people or your lineage, you have somebody who has ever suffered from any cancer or cervical cancer, you can get cervical cancer just because other people from the background, especially your mother, your sister, your brother doesn't have a cancer. Sorry, especially your mother and your sister, and those people who are close to you, if they've ever suffered cervical cancer, you can be at risk of getting cervical cancer. So, how can we prevent this cancer? Let me talk about the prevention first before I tell you signs and symptoms of cancer. How can we prevent this cancer? There are several ways which cervical cancer can be prevented. Number one is regular screening. If you go for regular screening, you are able to detect if you have cancer at an early stage so that it can be managed. It can be managed when it is at early stage. And also, there is a vaccine that is called human HPV vaccine, human papilloma virus vaccine. And this vaccine was discovered in in Kenya. The Kenya started using this vaccine in the year 2006, and this vaccine has been in the field, and those who are supposed to get this vaccine are children. How can you children? Ladies or young girls who are in the age of 9 to 12 years were supposed to get 2 doses of HPV vaccine. And the reason why it is being given to only 9 years is because we assume that a 9-year-old girl has never engaged in sexual activities. So even if there are some percentage that usually start engaging in sexual activities at early stage, but they usually assume that 9-year-old girl, even if they have already started engaging in sexual activities in early age, it is not much and they are not much exposed to this virus. So that is the time they can give this vaccine, HPV. So if you have a girl child who is 9 years, you're supposed to go to nearest clinic or nearest hospital so that your child can get vaccinated against HPV. It is prevented through that. So other prevention, like I say, the causes, if you are smoking, you should stop smoking. If you are somebody who is using oral contraceptives, you should stop using those oral contraceptives because they expose you to human papilloma virus or cervical cancer disease. And if you are somebody who is having so many multiple sexual partners, please, you can stop that habit because you are exposing yourself. And if you have a partner who has not gone for circumcision, you should tell your partner to go for circumcision because this virus can be transmitted from one person to another, because they usually say that men are the people who carry this virus because of their bad behavior. So if your man or if your partner has not been circumcised, advise him to go for circumcision so that you can be safe. The last thing about prevention, you can also check on your diet so that you avoid being obese because you will be at risk. Then the next thing that I'm going to say is or are signs and symptoms of cervical cancer. How can you know that you are having cervical cancer? The first thing, you will have lower abdominal pain. And this lower abdominal pain will be accompanied by abnormal discharge or you can have vaginal bleeding that is not menses. And after all those, you can also have irregular menstrual or abnormality of menstrual period, of which you can have spotting, you can have amenorrhea, you can have dysmenorrhea, you can have menorrhagia, you can have what else? You can have metrorrhagia. You can have so many menstrual abnormality that will set in when you have this cervical cancer. And also another thing that you can experience is weight loss, because it is cancer. Usually patients of cancer usually suffer from weight loss. And explain weight loss, you can also suffer from this, and you can also experience sometimes nausea and vomiting. And how can we manage this cervical cancer? Even though cancer, they usually say that if you have cancer, sometimes it is difficult to treat it or to manage it, especially if it has been diagnosed at an advanced stage. So if it has been diagnosed at an early stage, there are possibility you can survive. And this, how can the doctor manage this cancer so that you can survive? Number one thing that the doctor will do, you will be done for radiation, you will be done for, or you will be given chemotherapy drug, anti-cancer drug, and also you can be treated on using these both methods of, of cancer treatment. Several methods. There are many other methods of treating cancer. I had already explained them when I was talking about cancer. So you can go and watch about it and watch that video. So the doctor can suggest radiotherapy or chemotherapy, or the doctor can use both treatment. So guys, if you are watching this video for the first time, please consider clicking that subscription button. And if you're a returning subscriber, I will always appreciate. And let's meet in my next video. Bye.